Hello everyone, with you Dr. Demchenko, and today I will tell you how to work specifically with acute pain in the sciatic nerve. It is a very common symptom, but in order to understand that the sciatic nerve is specifically hurting, you should have several signs. First, it's a pain that goes from the lower back or buttocks to the very foot, or pain below the knee joint, that is in the calf or foot, of a shooting nature. That is sharp, short, while with a neurological tint, that is you may have numbness in your fingers or foot or tingling. There may also be drops in skin sensitivity. That is, you touch the skin on your foot and shin more often, and it is less sensitive than the rest of the skin areas. With sciatic nerve syndrome, pain most often occurs when you lean down with a straight leg or try to stretch your leg forward. These symptoms are due to the fact that the nerve sheath does not stretch and the tendons and muscles have a certain elasticity. And when you bend down or stretch your leg, you have to somehow stretch the nerve through the soft tissues. When the nerve is compressed, there is swelling, which is due to the fact that the arteries that supply the nerve with arterial blood are quite dense and it is difficult to squeeze them. But the veins that take blood away from the nerve have a very thin wall and they are easy to squeeze. It turns out that blood enters the nerve, but comes out poorly. And because of this, a sufficiently intense swelling of the nerve occurs, which additionally compresses the nerve tissue. That's why the symptoms get worse if a person sits or lies down for a long time, that is, does not move, and the blood gets even more stagnant and the signs intensify.
Of swelling.
The first priority in such treatment is firstly to remove the block, that is to stretch the piriformis muscle or reduce inflammation and gnawing of the nerve in the sacrum, and secondly, to reduce nerve swelling. To reduce nerve swelling, anti-inflammatory drugs and physiotherapy are used. And it's also very good to use special exercises to relieve swelling and nerves. The farthest nerve has already quite strongly lingered in the place of spasm, and to pull it through this clamp is practically impossible and it hurts enough. But by mobilizing the nerve in the opposite direction, we can give enough movement to the nerve to improve hemodynamics, to remove swelling. According to Michael Shacklock's research, reverse traction can be created through a healthy end because the nerve attaches to the spinal cord at the healthy end and can transmit movement to the blocked sick nerve when stretched. Visualize this exercise as follows. Imagine this is the spinal cord and these are the sciatic nerves. If we have one sciatic nerve that is pinched and pulled to this side, and it pulls very hard when you start to bend or straighten your leg, the nerve becomes even more stretched towards the foot. To reduce the tension of the nerve towards the foot, you can use work through the opposite leg. When we pull the opposite leg, the nerve begins to shift away from the foot side. Therefore, in the acute stage of the process, we need to maximally relax the nerve from the sick side and maximally stretch it from the healthy side. Initially, static extensions are used. Then you can dynamically, that is, actively work with the healthy side to improve blood flow. When the blood circulates well in the nerve and the swelling decreases, you can already work with the healthy side as we showed you in the video about the treatment of the sciatic nerve. On cue. In case of severe pain in the left sciatic nerve, lie on the painful side, slightly bend to slightly stretch the spinal cord. If this already causes pain in the spine, then you can lie more straight.
But if you have the ability to bend until pain, don't go into pain. For example, up to this level. The sore leg should be bent to relax the nerve. On the healthy side, perform nerve stretching through knee bending and pulling the foot towards you. In the acute period, you can use static stretches. That is, just put your straight leg in and stay in this position for 20 seconds. Then bend both legs and rest for about a minute. After a minute, you can again put your stretched leg and also lie for 20 seconds. After you have done such a cycle of procedures, see how you feel. If you feel better, then to the next approach in 1.5 to 2 hours, you can try the dynamic version. That is, straighten the leg, pull the sock slightly towards yourself and relax. And straighten the leg, pull the sock towards yourself and relax. Do this for a minute, don't rush. Usually such actions make the sore leg feel better. You can do this exercise
during the day, every hour and a half to 2 hours. If you feel better and you can squat deeper without shooting pain in your leg and the pain in your leg decreases, you can slightly complicate the exercise.
To complicate the exercise, you can either bend more in the spine or slightly straighten the sore leg and repeat the procedure. You can slightly bend your knee and foot towards yourself as your condition improves. You can slightly bend the sore leg. Remember, never go into pain on the side that hurts. That is, for example, if I feel pain here, then I will perform the procedure approximately at this level. If you don't complicate the exercise, that is, bend your spine more or stretch your sore leg more, then progress in improvement may stop. So try to always do this exercise in the pre-pain amplitude.
Usually these exercises can be done over 2 to 3 weeks until you experience enough sharp pain in your leg. I want to remind you once again that before moving the nerve, it is desirable to try to slightly relax the pinch on the nerve that bothers us in the area of the pear-shaped muscle and the vertebrae. For this, before performing these exercises, try to perform the exercise from the video clip as directed. As it becomes easier for you and you can already lean forward well, move on to the nerve movement techniques from the second video clip. These techniques are not the only treatment in a situation with the sciatic nerve, but they can significantly improve your condition. Good health to all!